Trinidad and Tobago, and arrived in the U.S. at 3 years old, grew up in New York, and currently lives in Far Rockaway. She has no close family in Trinidad and Tobago, and all of her immediate and most of her extended family live near her in New York. Brittany's DACA status expired only 1 week ago on December 7th. Before her work authorization expired, she was the full-time caretaker for a family in Brooklyn with two 14-month-old twins, one of whom has special needs and requires physical therapy. Brittany, please come forward and tell us your story.
Hi, everyone. Bear with me. I'm sick. It is Thursday morning, and I should have been on my way to the local story time at this hour. I should have been pushing a double stroller while the twins were singing out to everyone that they passed in Brooklyn, but I'm not. Instead, I am here, and though I'm honored that you've chosen to hear my words, they do not come easy. My DACA expired a week ago as of today. No, it was not because I wasn't eligible. I mailed my application in on September 21st, way before my DACA expiration date, which was December 7th, and due to a clerical error, where one signature out of the many signatures required was missing, my application was mailed back to me on the day of the deadline, which was October 5th. I, in return, mailed it back out the very next day, along with a green paper that stated it needs to be placed on top of the application, and eventually received a rejection notification stating that new applications were no longer being accepted. I was now faced with the reality that not only was I no longer able to work legally, but I was about to lose a job with a great family who I care about deeply and care about me in the same. I've had the luxury of watching the twins progress and gain individual personalities to which I've come to love as I would my own family members. From walking to even their first words, I have been there for it all. Not only has this been a stressful situation, but it has been trying. Instead of enjoying my holidays, I'm in a constant mode of thinking. I'm in a constant exhaustion that I can't shake off. My family, as well as myself, is affected by this decision, and we are forced to maintain a sense of hope because without it, we don't have much. My sister and I were always taught to never say we can't do something. Our parents wanted us to believe that nothing was unattainable and that anything was possible if we worked hard for it. Those were the foundations that I was raised on. I'm aware that I'm not the only one in this situation. I'm aware that there are other families that are going through what me and my family are at this very moment. This is why I am here. My message to those who are in this situation with me: don't lose hope. Connect with organizations like National Immigration Law Center and make our voices heard. I'm not just a dreamer. I'm a daughter, a sister, and an aunt to a beautiful nephew. I'm a body of untapped potential just waiting for a chance to release it. I cannot stress the need and the importance that a Clean Dream Act is passed before the holidays. Not just because it is the right thing to do, but the humane thing to do as well. I hope that my Senator Schumer, and all members of Congress will follow through on their commitment to get the DREAM Act passed before the end of the year. Every day, there are 122 people like me losing DACA and at risk of being detained and deported. Please do not leave the holidays with your families while leaving me and my family and tens of thousands of family like mine in legal limbo. Give me and others like myself the chance to shine and the chance to dream the way that others do. Give us our smiles back and our endless hope. Dreaming is not against any law, but what is truly against all laws is taking another's opportunity to do so. Thank you.
Thank you very much, Brittany. And there are some 800,000 dreamers in our country. Brittany's story is one of 10,000 and counting of dreamers who have already lost their status. Now I'd like to turn to my colleague, Senator Richard Blumenthal of Connecticut. Thank you for being such a champion.
Thank you. Thank you so much, Senator Hirono, for being a champion. And thank you for bringing us together today. Thank you to Brittany and all of the advocates for your tireless and inspiring work. Truly, your leadership by example has given us hope and heart. And very simply, Congress should not leave for the holiday without passing a DREAM Act. It is that simple. We should do our job. We should pass a measure that will guarantee legal status for the Dreamers and a path to citizenship. That's been our goal, and that must remain our goal. There is no excuse for waiting. In fact, waiting is reprehensible. It will continue the nightmare that these Dreamers are already suffering, and it will continue the administrative hurdles that must be overcome. But Congress should not leave for the holidays without approving the Children's Health Insurance Program and Community Health Center funding. Today in Connecticut, as we speak, the Department of Social Services is preparing notifications that will go out tomorrow, literally tomorrow, to families throughout the state, telling them that their children's health care may be eliminated, that they will no longer have access to the CHIP program. The anxieties and apprehension that they feel is unforgivable and unnecessary if this Congress does its job. They are going to be applying for emergency reserve funding, which they will need simply to continue meeting the basic health necessities of children who depend on them. But absent congressional action, Connecticut will join many other states forced to act for reserve funds so they can continue receiving health care coverage. And absent immediate congressional action, many of those families may have no provider. And we're talking in Connecticut about literally tens of thousands of families that will go without health care because Congress is failing to do its job. The community health centers, likewise, are nearing the end of their financial rope. One such clinic in Hartford has already contacted me saying that without congressional action, their funding will soon be gone. Despite a small grant from depleted 2017 funds, they'll be forced to cut staff, services, and patient care. The situation is unforgivable. Even to require them to go through this state of uncertainty and confusion and possibly chaos is entirely avoidable and unnecessary. So Congress should do its job. There are 8,000 Dreamers in Connecticut, 700,000 around the country. They are depending on us, and we should fulfill the promise we have made to them, to children who need health insurance, to everyone who needs those community health centers, and we should not leave without completing this basic task. Thank you.
Thank you, Senator Blumenthal. Let's just always keep in mind that what's happening here is rather than reauthorizing and funding the Children's Health Program and the funding for the rural health, community health centers and the DREAM Act, the Republicans are spending all their time pushing through a tax bill that's not going to help middle-class families. I'm glad that I'm joined by my colleagues from the House. So if you don't mind, I'm going to start with Pramila Jayapal of Washington State, another very, very strong voice for our priorities.
Thank you so much, Senator Hirono, Senator Blumenthal, and our incredible champions in the House. Michelle Lujan Grisham has been fighting on our behalf and leading the Hispanic caucus through, I think, just one of the fights of our lives. Linda Sanchez, one of our caucus vice chairs, thank you for your incredible leadership. But most of all, I want to thank Brittany. And I know that there are some Dreamers from Georgetown University as well, my alma mater here. Dreamers, oh, excellent. Dreamers across the country who have been speaking out, who have been in the streets, who have been organizing. I come to this body as a longtime immigrant rights activist, started one of the largest immigrant advocacy organizations in the country in Washington State. And we've been fighting alongside dreamers and being inspired by the courage of people's personal stories as they come into our streets and into our consciousness to say that America is about our dreamers, is about bringing people who can contribute to the country, who have family members here, who have lived here, who have been part of our communities and deserve to stay. And the reality is that as an immigrant, Senator Hirono is an immigrant as well, born outside of the United States, we're only about a dozen of us in the United States Congress. But I'm an immigrant from India, and I know that what makes me inspired about this country and what makes me inspired about serving here in Congress is that we have always been a country that has understood the value of immigrants to our country. And so we are here today to say, just as women came out in full force in January, just as we fought to defeat 3 separate Trump care bills, just like the flood of calls and letters and emails that we're receiving about net neutrality, the billionaires' budget, pushing back on the tax bill, as Senator Hirono said, we need to use that same force to stand up for our dreamers. Because immigrants are the backbone of our nation, and they should always feel welcome here. So it's not just the 800,000 dreamers that have DACA status. There are 1.5 million dreamers across this country who are eligible for DACA status, haven't applied, and it is our job to stop using dreamers as a political football. When President Trump took away DACA status, you heard from Brittany what happened to families across this country, the uncertainty of being thrown back into the shadows, particularly cruel, given that we said to dreamers, come out and give us your information and we will protect you. So now to take away DACA status and to use the argument that it's Congress's job to pass this, but then to refuse to allow a bill to come to the floor, we know in the House that we would have the votes to pass a Clean Dream Act on the floor, if it were brought to the floor. And so our message is that in the House, there are plenty of Republican votes. They have the majority. If they can pass bills without Democratic support, then we don't have a lot of leverage. But if they need Democratic votes, then our priorities need to be reflected in those bills. And we need to have a Clean Dream Act that we can vote on and in order for us to go home. And that is just where we are. We need to have CHIP funded. Let me just say that CHIP covers 8.6 million kids across the country. It costs us $15 billion, and yet the tax exemption for the 5,400 wealthiest families around the estate tax costs $20 billion. So for us, we have to see our dreamers protected as we move forward, and we are committed to that, and we want to say to dreamers across the country that you have champions here. We are going to fight to make sure that we protect dreamers across this country who deserve our attention, but most of all, who deserve the opportunity to dream and to have a future that they don't have to worry about from month to month. So thank you so much, Senator Hirono, for your tremendous leadership, and you can be assured that we are going to do everything we can in the House to fight for this.
Thank you very much. In fact, I just heard President Trump this morning saying something about the tax bill, saying everybody's going to get a great big Christmas present with the tax bill. That is not the Christmas present that we're all looking for, not by a long shot. Right. I want to call upon my friend Congresswoman Linda Sanchez of California, another huge voice on our priorities. Please, Linda.
Thank you, Senator. And it is a pleasure and an honor to stand with such feisty women who are fighting to get the priorities of this country accomplished before the end of the year. There are only 5 legislative days left this year, and we have a lot on our to-do list that needs to get done. Democrats are fighting to pass legislation that working families and children all across our country rely on. Many of the bills that we want to see scheduled for a vote are bipartisan, and they enjoy broad support among the American people. And yet we have a Republican leadership in the House and an administration that doesn't think that these priorities are worth completing before the end of the year. They've frittered away their time and have very little accomplishments to show for the legislative year. And we are here to say it is time to do this country's business and to get it done. The American people rely on us to do our work, and yet they have completely just wasted the year in not advancing important legislative priorities that people and families rely on. You've heard some of my colleagues mention the Children's Health Insurance Program. That has enjoyed broad bipartisan support, and Congress has always worked across the aisle to find common ground to keep the Children's Health Insurance Program funded. Congress has to act quickly to reauthorize funding for the program, which expired at the end of September. Many states now are finding their funding running out, and they are in dire need of funding in order to keep the health and well-being of America's children intact. Think about that. What greater priority could we have as a country than ensuring that our children are healthy and safe? We shouldn't be playing politics with their lives. Community health centers are also on the line. They are essential to providing 25 million Americans with access to quality primary care. In my district alone, nearly 300,000 people are served by community health centers, and yet the Republican majorities are playing politics with funding for community health centers that also serve their constituents. And what they are doing is jeopardizing access to care and undermining, again, the health and well-being of Americans across this country. We can and we must extend funding to community health centers in a way that does not undermine other critical public health priorities, because the Republican approach to this has been to pit one of these key priorities against the other. That's a false choice, and we can do better. And finally, I can't think of a more important legislative priority to get completed before the end of the year than the DREAM Act. If Republicans are serious about actually doing something to help dreamers, then they should schedule a vote on the DREAM Act, because 122 dreamers lose status every day and it makes them eligible for deportation. So 1,000 talented, bright, young individuals in our country face that risk every single week that Congress does not act. I know that the Republican majority has sort of scoffed and said, oh, well, we have until March, and there's no harm until March. That is patently false. For these young lives, every day matters. And we have to do the will of the American people, because the majority of Americans support keeping these talented, giving, productive young people, giving them the certainty of being able to remain in this country legally. House and Senate Democrats are united in getting these priorities done before the end of the year, and we will do everything we can to keep the pressure on Republicans to include these important these important bills before the end of the year. It's a very long to-do list, but it's a list that we can accomplish if Republicans are willing to work with us. And so I beg them, please, not just to give the American people a present for Christmas, but think about completing the urgent business that our country needs to have completed. Please do the decent thing. Get all of these priorities completed before the end of the year.
Thank you. Thank you so much, Linda. And now I want to turn to Representative Michelle Lujan Grisham. She is the leader of the House Hispanic Caucus, and I know that you all have been working so hard on not just the DREAM Act, but all of us on all the priorities that we're talking about. And, you know, listening to all of our comments, doesn't it make you wonder, if the Republicans really want to accomplish something, why not pass the DREAM Act? That would be one huge thing, not to mention, of course, the other priorities we have. So, Michelle, please.
Thank you. Thank you, Senator.
I'm going to have to do press conferences on the Senate side more often because the stuff I can actually see over the podium and lectern, so I'm happy already. I'm really honored to have been invited here today because I agree. Some incredibly articulate, passionate, productive, smart women who are very clear about what the priorities are, not just here, but with the constituents that we represent every single day in this body. And what hasn't been said is that there are not only bipartisan support, we have Republican senators and Republicans in the House who have been working diligently, not just on DREAM, but making sure CHIP and other priorities are addressed. And yet, I want to add, it's Republican leadership in both chambers that is failing again to bring the issues for a vote to their members, because we know unequivocally that there's bipartisan support for both, making sure, and other priorities that really make the difference between life and death and your family and issues as you know them without passing this. And at a time of a deeply politically divided, unstable Congress, earnestly, I still believe it's possible to get these done, which is, I really hope that that message gets out. These dreamers are here today not because, we're saying shame on you. They're here because we know there's a path. We know there's bipartisan support. They can articulate better than anyone just exactly what's at stake. And we need that momentum and that pressure to be maintained in both chambers. And I can't think of a better way than to highlight again the Children's Health Insurance Program, thousands of kids and their families in my state. And what sometimes gets lost, I think, on people who are debating whether we're getting our priorities addressed is that these are kids who are really sick. Now, my sister had a brain tumor when she was diagnosed when she was just over 2. And it's before the Children's Health Insurance Program. It's in the 60s, and it's before the ability to really use Medicaid, and it's clearly when private insurance was actually in many ways kind of a new product. And if you think it was difficult, if you think it's difficult today, it was really difficult then. And I watched my parents for the next 20 years privately pay for life-saving treatment for my sister that bankrupted them emotionally and financially, and just trying to figure it out. And everything they did was aimed at saving my sister's life and seeing the impact that that had. Now imagine that you've got programs for just these reasons that are designed to support those children, to save their lives, to protect their parents and their families from these kinds of situations. And it is removed from you because we fail to reauthorize and fund it. And what it really means is that states, as soon as they're out of money, they stop paying providers. And in a state like mine, where we don't have sufficient specialists and providers, and we have a higher than per capita average in certain cancers and certain childhood diseases, this means these children lose access to their oncologists. Can you imagine? These children have no place to go except the emergency room, which means no treatment. That means no drugs are available. That means that parents are left without any of those life-saving issues. And it can be as simple as this. You've got a child with an autoimmune disorder. They can't get a flu shot now, because our community health centers, our primary care, as you've heard before, all of that depends upon this funding, which means the entire infrastructure for doing the right thing, for saving these children's lives, is upended because we won't let both members in both chambers, bipartisan, vote on them. Because if we did, they would pass. And the same stories are true for dreamers. And I think about a Pennsylvania father who is one of those Osman Enriquez, right? A father of a young son who is out of status, not because he failed. Let me tell you, how precarious is it that in this environment with this kind of instability and this effort by a federal administration who has made it clear by their actions that we are deporting individuals that were never meant to be deported, dreamers who know no other country as their own, his didn't get delivered on time by the U.S. Postal Service. He lost status. He went through a routine checkpoint and was detained, deported. How are we living in a country that would treat its families and individuals so cruelly, and the people who can fix it are right here in this room, and there are Republicans who want to fix it? So I call on you to support these dreamers, to support mothers and fathers, to support these families on all of the priorities, and force the leadership to give us the opportunity to vote on them and to create comfort, stability, morality, do all of the ethical work that we were all elected here to do. I couldn't be prouder to join these incredible advocates. I appreciate everyone who's fighting with us to win these battles. And I am staying optimistic because I believe in a country that wants to do the right thing here. And so says all the polling. This is a country that wants these issues addressed. Let's tell our leadership that that's what we expect of them. Real leadership right now before we adjourn for the holidays. Thank you.
Thank you. I want to thank my House colleagues. Notice that they're all women. Yes, for their passionate, focused advocacy. Totally. So now I'd like to introduce Maria Gomez. Maria Gomez is president and CEO of Mary Center and founded the organization in 1988 as a clinic to provide prenatal and postpartum care to Latino women living in Ward 1 in Washington, D.C. Mary Center serves over 41,000 participants from all over the globe at 5 medical locations, 2 senior wellness centers, and program offices throughout the District of Columbia and Maryland. Originally from Colombia, Maria immigrated to the United States with her mother at age 13 and attended D.C. public schools. Maria, thank you for joining us.
Thank you. Thank you so much. Also a proud graduate of Georgetown and Berkeley, great schools. And being an immigrant, I am so happy that this country has given me the opportunity to do great things, to pay it back, to pay it forward, and to have a great life where I would have never had the chance to in my own country. So I am here today to really help everyone in this room and in this country understand the adverse effects of not funding CHIP, of not funding the DREAM Act, and of not authorizing the community health centers' dollars. About a third of our children at the health center have CHIP, a program that enables parents to have a sustainable income so that a family doesn't have to end up homeless, that they're able to put nutritious food on the table regularly so that children can thrive and learn and go to school every day, and that they can graduate and go to college, all while having an insurance card to receive preventive health services and catch problems early. Something that most of us don't know. CHIP allows people to get hearing tested, sight, when they have poor sight, toothaches, learning disabilities, early signs of cancer, and even depression. And just this week, if I can tell this story, we were working with a bright 7-year-old referred to us by shelter because he wanted to kill everyone that was coming in his life. Everyone that came into his life, he wanted to kill. Because of CHIP, he was able to get admitted to a hospital for observation, diagnosed correctly because he had insurance. Get the medication for depression that he needed, be able to actually afford it and be monitored, and come to the Mary Center as an outpatient to be observed on a regular basis. I know that without CHIP, the observation bed would have been very difficult to get or almost impossible. The medication would have been unaffordable for sure. So what CHIP allows this mother to have is, first of all, a job. It allows parents to work and make a sustainable living while not having to worry about their children's health. Second, they have a peace of mind that their child, this particular mother, has the peace of mind that her child will get better because she has a community health center at her side. And to have some control over their lives. Parents need to have control over their lives. And people that Brittany, who we just heard, doesn't have control over her life. And imagine if those children were her, and she had a family to take care of. But we have families like that. Community health centers like Mary Center need CHIP, reimbursement for financial sustainability, but more important, to make sure that we provide equity and quality care throughout all the centers, regardless of what kind of insurance people have. So if the 70% of our grant from the community health centers is cut, this will put many of the programs that the medical piece, that Medicaid, the CHIP doesn't pay for, like being able to go into a home for a woman that suffers from domestic violence and assess and talk to her partner and see how we can remedy that situation or help that woman leave that home. It helps us to be able to diagnose people. Every single client that comes to our center, we do a small assessment for depression, for any kind of mental health problems that would lead to horrendous problems in people's lives. And more important, I think it will, and as important really, because these are individuals, it also will have a tremendous effect on the economy, because I will be forced, and I just did the numbers, I will be forced probably to lose about 100 people because this grant that I get from the community health centers allows us to provide the services that people do that Medicaid doesn't reimburse. So, but more important, the community health center dollars allows me to tell the private sector, I raise 3 times the money that the feds give me from the private sector because the private sector knows that the federal government is in partnership with us to provide care. And so I get those dollars. When those dollars are raised, those private dollars also go with it. So today, I am asking you, congressmen and women, to please have some compassion for dreamers, to please have some compassion for all the children in Connecticut that will receive that letter today saying that they will not have any more insurance, and have some compassion for all the people that walk in that health center to receive services, and to a lot of times to walk into a center just to have company and to have a peace of mind that someone in the world really cares about them. So I want every single one of you to spend your holidays knowing that you have made a difference in the life of a child and their family, and to know that that family will be the next generation that will continue to make this country great. Thank you for the opportunity today.
Thank you. Thank you very much. In short, stop with the misplaced priorities. Anybody have any questions? Yes.
According to the Guardian, the FCC just voted to scrap net neutrality. Can you give me a statement on that and what Democrats, or how Democrats should address this issue to resolve it?
Do you have a question relating to the subject of the press conference, which are the priorities that we're talking about?
Yes.
If anybody, if anyone has any questions that's related to the subject of this press conference,
If you make progress and get some of these priorities in a deal, and negotiations are still moving positively on some of the others, is there any chance that you are willing to pick it up in the new year, or are you saying that everyone will stand firm, all or nothing by the end of the year?
the negotiations are definitely continuing because, as mentioned, there's bipartisan support, certainly for the CHIP program as well as for the community health centers funding. In the House, there's a lot of support for the DREAM Act, as in the Senate. We just need to get these items before the bodies for a vote. So I am hopeful that with the 5 days left that we're going to be able to focus on the real needs of our country as articulated by us. So you know what? The Republicans are in charge of both the House and the Senate. So they could pass these bills like this, but they're not. So I hope that we'll reorder our priorities so that we can get the work of the country done as far as I'm concerned. So I'm hopeful that it'll happen. And we're not there yet as to what happens if it doesn't happen. And clearly for the Dreamers, 122 are losing their status every single day. They can't afford to wait till March. So,
Senator,
yes.
specifically on DACA, many of your own colleagues in the Senate, Democrats, are saying, well, maybe not many, but some are saying that there is time, that the same argument that even Speaker Ryan is saying, that some of you are saying that there is a path to get things done between now and next Friday. What is that path? I mean,
It's negotiations. That's what it is. That there are negotiations occurring right now as to how we can protect the dreamers, how we can have a DREAM Act.
So you think it's possible by the 22nd?
I am hopeful.
Can I just say something, Senator
Yes,
Hirono?
please.
Our leverage as Democrats comes if our votes are needed. And I will just speak for the House and say that on the last continuing resolution, there were 90 Republicans who did not vote for that resolution. They needed Democratic votes. And I do believe that we need to use our leverage for our priorities, because it's unrealistic to ask Democrats to vote for a bill that doesn't include our priorities. So a lot of this depends on, number one, will Republican leadership do the right thing? We know that there are votes to pass some of these things if they were brought to the floor or included in a budget resolution. And so that, I think, is the first thing. The second thing is, if leadership refuses to bring that forward, then they will have to get votes from Republicans to support those items that are, that are in their resolution but are not priorities for us. And so that's the negotiation that's going on right now and I believe that there are a lot of Republicans who want to see, for example, the DREAM Act passed. I mean, we had 30 Republicans who came out in the House. We're working very hard with them to say, how do we make sure the DREAM Act gets done? Because I think it's wrong to go home and know that 122 Dreamers every day are not getting their status, are falling out of status. This cannot continue, and we do, I think, as Democrats, have to use whatever leverage we have. Now, again, we don't control the majorities, and the Senate has a lot more power than the House does, but yet, we have not been able to get things through. The Republicans have not been able to get things through without Democratic support. So I would hope that that's the recognition and that there is a bipartisan coming together to craft something that will get both Democratic and Republican votes and that can pass in the House.
Yesterday, the House introduced in the CR the chip bill that they had passed previously that didn't receive a lot of Democratic support. Is there a chance in order to get chip done for this bill to see support from Democrats now in the House or in the Senate?
The problem with the House chip bill is that it essentially reauthorizes, but it requires children to pay for their own, families to pay for their own health insurance. So it is not really a reauthorization of CHIP. And so that we have been strong as Democrats in the House against that bill because it simply doesn't answer the question of how we take care of CHIP and the payment of CHIP. And I just think, I have to just echo Senator Hirono's point earlier, that it is outrageous that Republicans are focusing their energy on giving a huge tax cut to the wealthiest corporations and wealthiest individuals in the country when we have millions of people, middle-class families across the country who are going to be hurt by that, and when they're saying that we don't have the money to fund something like CHIP. Those two things just don't go together.
Let me just add that as for the CHIP bill that's coming over to the Senate from the House, there are a lot of poison pills in that bill. It is dead on arrival in the Senate because there are already 44 senators who have signed a letter saying we are not supporting this bill and it will need 60 votes here. They don't have it.
One more question. Anybody has any?
I can talk with you about it, Michelle. Okay, thank you very much.
Thank you, Senator.
Thank you. Keep on plugging away. Thank you very much.